It related to something I said yesterday about that somewhat paradox of everything going up at the same time that the feeding into this engine of this virus is starting to show some signs. So Governor Cuomo today reported an interesting data from New York, namely that the number of hospitalizations, the number of admissions to intensive care, and the number of requirements for intubations over the last 3 days have actually started to level off. So again, everybody who knows me knows I'm very conservative about making projections, but those are the kind of good signs that you look for. You never even begin to think about claiming victory prematurely, but that's the first thing you see when you start to see the turnaround. That doesn't mean we don't have a lot of work to do. That tells me, instead of saying, that's pretty good, it's we got there through mitigation. We cut off the stream of people who ultimately required hospitalization, required intubation, required all of the kinds of extreme methods. So we just got to realize that this is an indication, despite all the suffering and the death that has occurred, that what we have been doing has been working. So the call that I say every time I get to this podium is just keep it up, because this is going to get us out of it. This is our best and only great public health tool.
And are we starting to see that across many states? We're seeing the level of hospitalizations and deaths is lower than what we anticipated.
Well, you're going to see it most dramatically, John, in a place like New York, where you see it goes up and peak, and then it will hopefully, and I think it will, come down. When you have places like Seattle, which and Washington State, who did a really good job from the beginning, it never really did that, so they were able to keep it down. And on the charts that Dr. Burke showed, when you saw California and Washington State, they were fortunate, they did a good job, that it never really got out of hand. So again, this is a big country, and you have a number of different metropolitan areas. I think if we do it right, you're going to see those who have not peaked will not peak, and those who have peaked, the New Orleans, the New York, New Jersey, Chicago, Detroit, and others, you're going to see the same thing if we keep our foot on the accelerator.
Further questions for the team?
Yes, sir. I'm just following up Dr. Fauci's comment earlier about what it's like going to be coming back to normal, and until there's a vaccine, that there'll be gradual steps towards restoring normalcy. Under that, short of a vaccine, does putting 80,000 people, fans, spectators in a sports stadium, or 25,000 politicos in an arena for a political convention this summer make a lot of sense? Or does those sorts of things require a vaccine to fully protect the American populace?
No, I don't think that you're going to have to say that the country cannot get back to a real degree of normalcy until you absolutely have a safe and effective vaccine. It will be really evaluating the kinds of things, and that's the reason why it was discussed up here, why it's so important to have an antibody test so you know what the penetrance is in society. And then we have a situation where we don't ever want to get to have to mitigate. We want it to be able to contain. And by the time we have to face what's going to happen with this going back to normality, we will have in place the capability of identifying, isolating, contact tracing, so that it never gets out of hand. Ultimately, the showstopper will be obviously a vaccine where you can vaccinate people and you won't have it. There's going to be another issue that's going to be important, and it has to do with somewhat of a comparison, for example, with influenza. We go through multiple cycles of influenza. There's always a degree of background immunity in the population. I mean, that will ultimately happen if we get a situation where we get back to normal. Now, I hope we don't have so many people infected that we actually have that herd immunity, but I think it would have to be different than it is right now. So again, remember when you say normalcy, I mean, we could get back normally, economically and otherwise, without necessarily saying we're going to forget about the virus. We have to pay attention to this because we've had a very bad experience with this virus.
Dr. Fauci, can I follow up on that, please?
Thank you, and this is for the Vice President, for Dr. Birx and Dr. Fauci, but can you give us a sense of, and I know you don't want to make any projections, but where we are with the numbers, because we saw that horrible number today, more than 10,000 deaths now in the U.S. are we on track for those best-case scenario numbers that you had laid out, the 100,000? Or are we potentially coming in lower than that at this point, given some of what you're seeing?
You know, it just gives me an opportunity to thank and respect the modelers who have really worked on this, because there's a large number of them have worked very hard and done a lot of predictions. And what we did is we did predictions of predictions. We like to integrate data, and so that's where you come up with these numbers. I think Dr. Fauci and I both strongly believe that if we work as hard as we can over the next several weeks, that we will see potential to go under the numbers that were predicted by the models. And I think that is really two things. It is the extraordinary compliance of the American people and the diligence that they have mitigated with. Because remember, we are doing this strictly by behavior change. It's very hard to change trajectory of viruses on just behavior change. We have had difficulty in our past doing that. So that's what we're doing, and that's what the American people are doing. But the other side of that is the incredible insights that Washington State and others are providing on how to better care for the patients in the hospital. And so those two pieces are coming together that could have a dramatic impact on the predictions of the mortality from this disease.
So I'm glad you asked that question, because I've said it a couple of times here. I want to say it again. Repetition is good. Is that models are good. They help us to make projections. But as you get data in, you modify your model. And I've always said, data always trumps models, always. So what I feel, and I believe that Dr. Birx also feels, that I don't think anyone has ever mitigated the way I'm seeing people mitigate right now. This has never happened in this country before. So I am optimistic, always cautiously optimistic, that if we do what I've been talking about over the past few minutes, we can make that number go down. I don't accept every day that we're going to have 100 to 200,000 deaths. I think we can really bring that down, no matter what a model says, because when the data comes in, they'll start to say, maybe you are essentially overshooting the model. And I think that's where we can go. That's the reason why I like to always get up and tell the American people, it's the virus doing what the virus wants to do, and it's we as a society doing what we can do.
And let me just amplify that from a layperson's perspective. And the American people are doing it. I mean, the initial data, what we've seen in California and Washington, support the fact that the American people are doing these things, which is nothing short of loving your neighbor. I mean, the truth is, the threat of serious illness for most Americans is relatively low. But the threat of serious illness for seniors with underlying health conditions or anyone with an immunodeficiency is very high. And when we see Americans putting these principles into practice the way you all have been, it really means you're considering others more important than yourself. And I have to tell you, for the president, for me, for all of us, it's deeply inspiring. We just need to continue to do it for all of these 30 days, and we'll bring that number down. How about a couple more, please?
So, Mr. Vice President, when do you think that you will know whether or not you will have to extend those 30-day guidelines, or if 30 days will be enough?
Well, the experts told us that somewhere around the middle of this month would be the peak. And as we begin to see a couple of days that might be the beginning of leveling, we're gonna watch that carefully, and we're gonna bring that information to the president. But for now, the decision is, and the request of every American, is to continue to put into practice all of the president's coronavirus guidelines, 30 days to slow the spread. And for all of you in areas that have been impacted broadly by the coronavirus, listen to what your state and local authorities are asking you to do. It will protect your health, your family's health, and it will save lives. let's do a couple more, and for our panel, if you'd like. Jeff?
This is more of a personal question, but Dr. Burks, can you tell us if your granddaughter's okay? And
I'd like to know too.
Well, thank you. Due to the great care of my 91-year-old nurse mother and my daughter, she's down to like 100 to 99 now, but it was 3 days of 104 and 105, which is, babies can do that, but it's very scary, especially when I couldn't assure myself that she was fine. So it was just some sleepless nights for me and them as they kept our fever down. So thank you for asking.
do you have the virus?
Oh,
or-
no, I'm sure it's roseola or something. They have not been out of the house. They're not allowed out of the house. They've got 2 granddaughters under 1, 2.5 almost, and one only 10 months, and my 91-year-old and 96-year-old. So no one is allowed in that house or out of that house because there's too much precious cargo inside the house.
How about one more question? We'll let
Thank
you
you,
all.
Mr. Vice President. For whoever wants to answer this, it's a technical question. So FEMA says that it is in the process of distributing 90% of each state's allocated supplies for the National Strategic Stockpile. And that allocation is determined based on population by the last census in each state. And the other 10%, it says, is going to frontline healthcare workers serving in the federal response efforts. So where are those healthcare workers in the federal response? And do you envision a scenario in which you could start giving states more supplies from the National Strategic Stockpile?
It's a really good question. And let me say the Strategic National Stockpile, and I'm going to have Admiral Giroir speak about his piece of that, has been largely deployed. We are continuing to replenish it in part with a small portion of what's coming in from around the world. You've heard about our air bridge, now more than 50 flights that have been scheduled that are bringing millions of supplies into the United States. What we're doing is taking less than 10% of that, put it into the Strategic National Stockpile, so we have that to basically provide for states on an as-needed basis. But the other 90%, that system that I just described earlier when the President was here, is working with the 6 major medical distributors in the country to deploy those resources to New York, New Jersey, Connecticut, Louisiana, Michigan, Illinois, the exact priority that you just heard Dr. Burks describe and that the data informs. And those decisions are being made every single day. And so while if a hurricane hits Florida or tornadoes or flooding tear through the state of Indiana, we're very accustomed to FEMA coming in, drawing from the national stockpile, providing specific resources. In this case, with a nationwide effort, what President Trump directed us to do was literally marshal the resources of the full economy to be able to make sure that we can meet the needs for personal protective equipment, ventilators, and all manner of supplies. And we're doing that in a small way through the Strategic National Stockpile, but in the largest way through that control tower system that Admiral John Polovchik is running for us, that is deploying those resources and making sure they're going straight to where they need to go. And as I said earlier, those decisions are being informed by the data, and they're literally being made by our team at FEMA on a daily and sometimes hourly basis. And we'll continue to keep you informed, as we did today, about where some of those are going. But let me let Admiral Giroir finish that answer.
I don't really have much more to add to that. The Vice President is certainly well informed about that. And I want to assure you that all the sourcing around the world, if it's there, we're putting it in our supply chains. We're buying more. Manufacturers are stepping up to the plate. And this is going not just by percent allocation, but it's going to the exact places that need it in the quantities that they need to take care of patients. And we want to make sure this is a two-way street. We get the data in from individual hospitals to know exactly what their burn rate is, exactly what they need. And we want to make sure that they feel comfortable that they're going to have supplies because they will. Because part of this is about potential shortages, some places. Most of it's about a fear of a shortage. If I'm a physician in an ICU and I'm not sure that it's going to be there, that's going to scare me. It's going to scare my nurses. So we want everyone to have that assurance that we will provide you what you need over weeks, periods of time, exactly to your need. And Admiral Polubchak and his team, and again, it's all military in there. I mean, he is the logistics guy for the Joint Chiefs of Staff, right? This is what he does. He is a wizard. There are more stars around me in the DoD part of the military than I've generally seen outside of the Pentagon. This is really being run as a military operation. I'm in the U.S. Public Health Service, so we're part of HHS. The Surgeon General and I have the honor of running that service. We are shoulder to shoulder in the field, in the military hospitals with everyone else. There are only 6,100 of us. 3,000 are doing direct patient care on a daily basis. We take care of the Indian Health Service, the Bureau of Prisons, those in detention at the border, et cetera. That's what we do. The other 3,000, over 2,000 of those are in the field already, taking care of patients directly, and we have more going out the door every day.
And if I could just follow up on that very quickly then, is it even worth then governors writing into FEMA if they've already received their 90% allocation and you're getting data directly from the hospitals to ask for more at this point?
This has been a very cooperative interaction. I bet I talk to 5 governors a day, and we talk out the issues and understand what they perceive in their state. They often help point us to particular areas that they feel need more attention or there needs more communication. So it's been very productive. I have to look up what governor goes to what state because that's not my world, but it's been a very productive interaction. So I think all of this is necessary. I'm on almost every governor's call with the vice president. They're very meaningful, they're impactful, they're informative, they're communicative. We talk to each other, but then we do get down to the individual hospital level because when the rubber meets the road, you got to know what the docs, nurses, respiratory therapists, the people who clean the rooms are an important part of the team. I want them to come to every work saying, it's not that I clean a room, I'm saving lives today. And they are saving lives by keeping the viruses off the surfaces and reducing transmission. So you've really got to get that granular, and we're to a point with Admiral P's. You have 2 admirals with the worst pronounced names in the world, so Admiral P, Admiral G, but Admiral P's team really has this covered down to the individual hospital level.
Thank you, sir.
Let me say, just by way of closing, because I thought that last question was helpful. We're interacting with governors every day, 7 days a week, and we welcome that. And while there are some resources in Strategic National Reserve, we spoke about ventilators. We have some 9,000 ventilators on standby. We also have this vast array through the commercial system that when we hear from governors, we're identifying the needs. They're working every day to identify their hospital capacity. We went over governors today saying we need to know what your capacity is, what your normal capacity is, what your surge capacity is. We need to understand what your equipment complement is across the state. And governors have been doing this. They've been assembling that information. But I want to tell you, the governors across this country in both political parties have been doing a remarkable job. And the president's grateful, and I'm grateful. And I just want to know that those healthcare workers that they're serving and the families that those healthcare workers are serving can be confident that we are going to do whatever it takes to get them what they need when they need it. And every governor is working in that regard. Every hospital administrator is working in that regard. And the opportunity that we have, because the American people are stepping up so strongly and putting others ahead of themselves. In most cases, they're acting in a way that puts the health of others first. We're more confident today than ever before that we're going to be able to provide our healthcare providers and the states that are impacted with the coronavirus with the resources and the support they need to meet this moment. And we're just going to continue to work our hearts out and make that a reality. But I have to end with just a reference to the healthcare workers. You've heard these doctors talk about them. They're all healthcare people. You've heard the president talk about them. You all have seen them. And to think what these healthcare workers, doctors and nurses and medical assistants are doing every day. It inspires us to get up early, to stay up late, to keep working, to make sure they have what they need to be able to continue to do their job courageously. And I know I speak on behalf of every American when I say how grateful we are for each and every one of you. And in this very special Holy Week, I know millions of Americans are praying for our healthcare workers. I saw a picture that I sent out last night on Twitter. It was an article about a series of cities where doctors and nurses had paused to pray for the patients and the families that they were ministering to. And I just want to say to all those healthcare workers, I know there is a chorus of prayer going up every day for all of you. And with your continued courageous service and with God's help, we'll get through this. And we'll get through it together. Thank you all.